I'm Miles Cameron in Greenbrae. You'll hear about the low-cost alternatives to the sky-high prices of medical care.
I'll tell you how the legacy of a world-famous comic strip artist continues to live on in Sonoma County.
We'll have these stories, and Habitat for Humanity helps people obtain the American dream. Tonight on North Bay Report. Good evening and welcome to North Bay Report. I'm Curtis Kim. For most people in Marin County who seek emergency or primary health care, Marin General, of course, is their first choice. But next to Marin General is a remarkable facility that serves the public's health needs that many people may not know about. Miles Cameron explains.
Tucked away on a hillside behind Marin General Hospital grounds is the Marin Community Clinic, otherwise known as the MCC. It's a nonprofit agency providing comprehensive, quality primary health care services to low-income and needy residents of Marin County. It began in Mill Valley in 1971 and now has 2 clinic sites, one in Greenbrae and a second site in Novato. All medical staff at the clinic are highly qualified professionals who have chosen to work with those in need. The clinic functions like a regular medical practice, with patients returning to see their chosen primary care provider whenever possible. But just who are these patients?
That's a great question. Our clientele are really the infrastructure of Marin. Basically, my patients, which are the pediatric patients, are the kids of the people who mow our lawns, the nannies who take care of our kids, the people who are working in the stores, and the people who are building our homes.
Well, there's different categories, you know, and primarily it's people who don't have access to insurance or are either on the program like Medi-Cal, which is the Medicaid, basically. We have people also from the Latino community, also migrant workers who don't have insurance. We have people who are working but don't have access to health insurance. I call that the working force, basically. And people who have had sort of chronic illnesses and don't qualify or have pre-existing condition and don't qualify for health insurance.
But practice as a physician, especially in a county as affluent as Marin, would be a lucrative venture. What inspired you to work in the public nonprofit sector?
Well, I've been here for about 6 years, and after I finished my residency in Southern California, just to say why I chose to do this kind of work is I'm from France, and in my country, you know, healthcare, everyone has access to healthcare. And I really feel like there's something that's lacking here, and I felt really that I have to give back to the community. And I really like to work in this environment, and it was very important to me to do this. I work also in a private setting, and I do a part-time here.
I actually, 12 years ago, came over here to start the pediatric department, and I was the former pediatric medical director up until last year. The reason why I chose this population, I had trained over at Oakland Children's, and I have always gravitated toward an underserved population. And just the thought of this county with so much wealth, to have a population that didn't receive adequate or possibly any health care just didn't cut it for me.
The Marin Community Clinic serves 13,000 patients each year, of which 5,000 are children. They operate 2 busy clinics, one here in Greenbrae, the other up in Novato. They serve 44,000 patients each year, including 13,000 immunizations. Among the innovative ideas being implemented at the MCC is the use of patient group appointments.
That's something we just started at the clinic about 2-3 months ago. The medical director and myself, we started, and it's going to go spread. But we have group visits, basically, where we would have about 8 to 10 patients together. The visit will last about an hour and a half. And the reason we started that is to be able to spend more time with the patients. It's an hour and a half instead of running from 10 minutes a visit. And a patient really like that. They have more time for education. They can really express themselves on a lot of different issues. And there's a lot of information shared from one patient to the other, and a lot more learning that happens.
Complementing those attributes of the group appointments is the incorporation of the Marin Community Clinic's Health Education and Lifestyle Planning Department with George Medina and Jan Ludke.
We are part of Marin Community Clinic's Health Education and Lifestyle Planning department. What we do here is we focus on patients with chronic diseases, including diabetes, asthma, and cardiovascular disease, and we provide education on how our patients could manage their diseases better.
And we also have a physical activity program, which consists of a walking club once a week to encourage our patients to stay active and stay healthy. We also run informational classes on things like foot care and nutrition, things like that. And we also participate in our doctors' shared medical appointments, helping them facilitate group appointments with diabetic patients.
Our physicians identify patients who could benefit from medical education specific to their disease, and we provide that education, focused education, whether it's nutrition or exercise programs or just helping them understand their disease and what they can do to better manage their disease.
I saw a patient actually this morning whose 14-month-old daughter had asthma, and so we gave her a little bit of information about what causes asthma, some of the things that you can do to eliminate triggers around your home, things like mold and dust mites, things like that. And she actually mentioned that her apartment was really moldy. There's a lot of mildew, a lot of black around the windows, so we were able to also refer her to some legal aid in Marin and some housing information in Marin so that she can sort of work with them and with us to talk to her landlord, get rid of that mold, clean up her house, and make the air clear for her daughter so she can improve her asthma symptoms, which was really, really nice.
In Green Bay, I'm Miles Cameron for North Bay Report.